Good evening, everybody. Warm greetings from Healthcare Professionals Forum. Today, we welcome our guest speaker, Dr. Indraneel Khan. Apart from being a brilliant oncologist based at Kolkata, Dr. Khan is a pretty well-known face among all healthcare professionals for his continuous contribution towards social issues concerning healthcare.
As you know, the entire world is going through some of the most trying times ever in the history of mankind. The COVID pandemic is running amongst the entire humankind. And amidst this entire, what we'll say is this, it's a very trying situation. It's a very testing situation. It's testing our nerves, it's testing our nation, it's testing the entire mankind as a whole. So amongst all this commotion also, the government of India, headed by the Honorable Prime Minister, Sri Narendra Modi, has launched the One Nation, One ID, which is of India has undertaken ever. Due to the different issues that are also going on along with the COVID and all these things, I think One Nation, One Health ID has not been discussed quite commonly, quite clearly also amidst the people. So it's a pleasure that Healthcare HCP Forum has actually hosted this wonderful evening, One Nation, One Health ID, or the One Nation, One Health card. There are different people who are saying this is just another card, it's just another hassle, but it's not that. It's going to revolutionize the entire healthcare system, the entire ecosystem of healthcare. It will ease out the pain of the caregivers of the patients across the country. You know how it's how this thing came into being. Actually, we, the professionals, the medical professionals, be it the doctors, be it the associated healthcare professionals who are working with us, be it the nurses, be it the paramedics, we have been seeing patients running from pillar to post, doing the test multiple times. The same test, for example, a patient who is from Purulia, a district in West Bengal. He had, suppose she's a 21-year-old female, she suddenly had a pain in her abdomen. And what's done is that she goes to the nearest emergency, and there the doctor says, okay, you are having pain abdomen, take some analgesics, that's painkillers, but get an ultrasound done. And when she does an ultrasound, it's seen that there is a gallbladder mass or something like that. There's some issue with her gallbladder. So in the One Health, One ID card, that is, the patient will have one unique health ID. And maybe it will be tagged to other whatever, that will be decided by the government of the day. And it will be one central number, like we have this other number. So that number will be there in the system. So once she enters a number in the system, a patient who has done a test in a reputed, in a quality lab in Purulia, for example, that same report will be showing up to the doctor who will be seeing her in Vellore or in Kolkata. And since it is accepted as a quality lab by the government of India, the doctor, be it in Vellore or be in Kolkata, won't be asking her to repeat the test. There will be no doubts on the authenticity of the report as well. And of course, to get into the system of into this national health grade or whatever, so the central repository, you have to maintain, every lab has to maintain some standards. Only then will they be made into they'll be allowed to put in their data into the system. And if you have quality labs with adequately qualified doctors, adequately qualified staff, I think that all these issues regarding the veracity of the different reports, regarding the authenticity of the lab results, this will also put to rest. So the patient, instead of suffering for 7 days, she will be subject to treatment the very next day. Even if she has done a report in some remote village of West Bengal, her report will be accepted wherever she goes, be it in Kolkata, be it in Mumbai, be it in Chennai or Delhi.